I really do believe that statin drugs are an extremely dangerous thing in our environment right now, and I am absolutely terrified to think about all of the disability that we're going to see looking forward with these people who have been long-term on statin drugs. And I think they are doing actually exactly the wrong thing to our health by disrupting our ability to supply cholesterol to all of our cells, and of course particularly the brain. So I expect that statin drugs will be part of the picture in what I predict will be an increased incidence of Alzheimer's in the future. I have published a paper that talks about a theory of heart disease that's based on the idea that the plaque is actually there as a factory for the production of cholesterol sulfate. And if you look at the literature and you read the papers, you can see that there's a perfect story, that the cholesterol enters the plaque and is stored in the macrophages, waiting for an opportunity to become cholesterol sulfate. It's stuck inside the macrophages because there isn't enough sulfate. Elevated homocysteine is a risk factor for both heart disease and Alzheimer's disease. Very strong risk factor for both of those. Homocysteine is a precursor to sulfate. Homocysteine can be turned into sulfate, but it needs inflammation to do so. It needs superoxide. Inflammation is recognized as a significant contributor to both Alzheimer's disease and heart disease. So the homocysteine actually goes into the plaque and attaches to the plaque, induces inflammation, and that inflammation then allows the homocysteine to become sulfate. Once it's sulfate, then the platelets that are also in the plaque are able to take the cholesterol and the sulfate and produce cholesterol sulfate, which can then supply both cholesterol and sulfate to the heart. And I think the same thing is going on in the brain. The plaque that develops in the arteries feeding the brain is there to provide cholesterol and sulfate to the brain. So ironically, the plaque, which of course can eventually block the artery, is doing something super important for the health of the organ that it's serving. And this explains why this plaque builds up in the arteries leading to the most important organs in the body. I mean, it actually makes no sense if you think that there's some junk that needs to be parked somewhere in the artery system. And where do you want to park it? Well, you don't want to park it at the place that's going to destroy your two most important organs, unless there's a really good reason to do that. And that really good reason is that that plaque is essential to provide those two key nutrients to the heart and to the brain, cholesterol and sulfate. So the answer to avoid the plaque is to get plenty of sunlight exposure to the skin and to stay away from environmental toxins that will disrupt your body's ability to produce the sulfate from sulfur sources. So this means avoiding aluminum, avoiding glyphosate, avoiding mercury, lead. All of these environmental toxins will disrupt your body's ability to maintain the sulfate that's needed to be able to transport the cholesterol to where it needs to go.